Hey, welcome back to the Summit Podcast. Today we're going to be talking about people who are new to Medicare and typically what they want to get out of conversations. I'm here with Tim, as always, and it seems like a lot of people are confused by Medicare. They're getting a lot of information, whether it be in the mail or online, and you've helped countless people who are new to Medicare navigate the Medicare enrollment successfully. So I'm glad to have you here today. I'm glad to talk to you about that. What do people typically tell you they want to get out of a conversation with you? Let's say, when they're approaching Medicare eligibility and you first start communicating with them.
Yeah, that's a good question. And I would say it is kind of all over the board. So I had somebody that found us online last week that was turning 65. So that's a pretty common scenario where they're turning 65 and they're going on Medicare. And she knew exactly what she wanted. She wanted a Plan G, a Plan N, or a high deductible Plan G Medicare supplement. She had already made the decision she wanted a Medicare plan. She had done research. She contacted me to get help with enrollment, but in her research, a lot of it was really good. But she also didn't really know about the new to Medicare discounts, the gym benefit, some of the finer points of it. But that's kind of one extreme. I would say about maybe 10 to 15% of people that contact me have a really clear idea and have done a lot of research. Probably a little more common, Jack, is when people have no idea and they'll come and they'll say, "Hey, I'm really confused about Medicare. I feel overwhelmed. I don't want to make a mistake. I'm getting, hammered with stuff in the mail. My relatives are telling me one thing, my coworkers are telling me another, and
Yeah.
I just don't want to screw this up. I know it's my health care. I want to get it right. I don't want to make a mistake. Can you help me?"
Yeah, that seems to happen quite a bit. You did touch on one thing. I know we've talked about it, in podcasts previously, but even if somebody knows a lot about Medicare, and maybe if you're watching this video, you are somebody that likes to do research yourself and learn about things yourself, but whether you know a lot or you've heard something from a coworker or a family member or somebody even who's already on Medicare, it still really would benefit you to talk to somebody who's a professional, because while the advice from your friends and family and that you read, that's also free, but so is an agent. So, it's always good to check with somebody. So, I mean, I'm glad to hear that that person that you're talking about did end up reaching out to you, even though they had some understanding of what they wanted.
Yeah, she was really happy. And so, she came into the office, we sat down, we went over it, I answered all her questions. We
Hmm.
did the enrollment right there. She was really thrilled. But in terms of advice from friends and family, of course, it's well intentioned. But one Medicare plan might work really great for one person,
Yeah.
but not as well for another. And
Hmm.
it can be very confusing with Medicare because most of the major carriers offer both Medicare Supplement, Medigap, and they also offer Medicare Advantage. So somebody might say, "Wow, I really like my United Healthcare plan," but the person doesn't really know whether it's Medicare Advantage, managed care plan, HMO or PPO, or whether it's a Medigap plan.
Hmm.
So they you can be led astray by somebody unintentionally.
Right.
Maybe your doctors aren't in that plan, and maybe that plan doesn't cover your prescriptions, or maybe you travel outside of the state of California frequently to go visit your family and that type of thing. So it's really important to go through all of that with an agent who has a lot of experience and can, bring up those issues that could determine what type of plan you want to go with.
Yeah. So would you say when you're meeting with new people, okay, um, do they typically want to learn everything from A to Z? Starting with what's Medicare Part A, what's Medicare Part B, what's a Medicare supplement, what's a Medicare Advantage, what's a prescription drug plan? Or are they just kind of like, hey, Tim, I trust you. Tell me what I should do. Here's my situation. What do you find is typically more common?
Yeah, I would say definitely the latter, where they want to know that and they trust you to guide them appropriately. But you do get some people who are very detail oriented, and I try to at least give them a basic knowledge of, the parts of Medicare and some of the kind of basics. In a way, it becomes somewhat irrelevant. Like, what is the Part A hospital deductible, or what is the Part B co-insurance amount? Because if you go with a Medigap plan, it's going to plug up the gaps, and they're really not going to be relevant to your coverage situation. If you
Right.
go with a Medicare Advantage plan, the deductibles and copays and coinsurance can be completely different. But some people want to know every little detail. For the most part, if we launch into an hour-long discussion before we get down to really like making a decision and selecting a plan, a lot of people kind of get fatigued at that point,
Yeah.
and it's a lot of information.
Yeah.
And so I try to gauge in on what people want and need in that situation.
And so if somebody was approaching the Medicare age, um, generally, I mean, we'll talk about agents in a little bit, but in terms of the process for kind of getting started, what would you recommend to somebody who's approaching Medicare age?
Yeah. Well, a certain amount of education is important. A lot of times we can accomplish a lot of that with a 30 to 45-minute phone call.
Right.
And that to me is a good investment of time, because many times, Jack, people will say to me, I've been looking at this stuff, and they throw their hands up and they say, I've learned about it, but I feel more confused than ever. And I don't want to make a mistake. So if
Yeah.
they can come to a trustworthy source, an experienced person that's either been referred to them, or they have very positive reviews online like we do. There's
Hmm.
a certain amount of trust once they begin to talk with you, and they can see that you have their best interest at heart. That conversation is a great way to
Yeah.
reinforce, and they can ask questions. It could be, interactive in that way, which is, some people really like to learn that way rather than reading or, even watching videos and that type of thing.
Yeah, and I would say also on top of that, in my opinion, I mean you know better than me, but I think it's good for people to kind of think a bit about their life in general and how it pertains to healthcare. I mean, you mentioned earlier, maybe this person travels outside of the state, that or even, across county lines, if you are in Northern California, but your family's in Southern California and you go down there to visit all the time, even that's important. Out of state travel is important. If you like to go out of the country, that's something to consider. How often do you go to the doctor? What type of prescriptions do you take? Do you think you're going to have to take a certain prescription in maybe 1, 2, 3 years? Do you have a specific doctor that you like to see? Do you have a medical network you enjoy? I think all of those things, or enjoy might not be the best word, but I think all of those things are important to think about because when we're talking to a person and in that initial phase, all of those things kind of play into what type of plan is going to work best for them. So I think it's good to have kind of an idea of your relationship with healthcare because sometimes you talk to somebody and they never go to the doctor. Not saying that's a good thing, but some people they don't like to go. And some people never go. Some people go 2, 3 times a month. So it really depends what plan you want on your relationship with healthcare and kind of your lifestyle in general, whether you're moving around a lot or you're more staying in your hometown area more.
Yeah. Yeah, those are all great points. I had a client one time whose daughter lived in North Carolina. I'm in Northern California,
Hmm.
and he had a massive stroke while he's back there visiting, and so he had just switched not too long ago to a Medicare Advantage plan, and they covered the initial emergency part of the treatment, but they were saying like you got to come back to get care in your network, and so they were they were elderly, they were in their 80s, and they were really worried and concerned. The wife was beside herself with worry about she can't get him on a plane and get him back to
Right.
California. So it is crucial for an agent to take your situation into account and be open to what might work for you based on your budget and your needs and your situation. If you sometimes people will contact an agent who's a you know pushing Medicare Advantage plans, and they're really more concerned about their own commission rather than trying to get the person in an appropriate plan and
Right.
explaining both sides of the story. So I think it's very important to make sure when you're discussing and these type of things with a Medicare agent that they're wanting to know about that, not just say, hey, here's ABC plan and this is the great, it's a popular plan in your area, that type of thing.
Yeah. I think sometimes insurance agents get a bad rap. And after, working with you and seeing how you operate, I think the way that you operate is a lot different than the majority of people. And it's a lot more personal kind of care. So with that, maybe we'll kind of move into talking about what are the different types of agents and kind of why do some people have um, maybe maybe might be a little bit wary about working with an agent and what makes you different.
Yeah, that's a good question. So sometimes people will, they'll know they let's say they for example they want a Medicare supplement plan, a Medigap plan, and they'll begin calling, let's say, Blue Shield or Anthem or United Healthcare, to get quotes on those plans. So of course if they call an in-house agent, what would call a captive agent who only works for Blue Shield. They're sitting in Blue Shield's office waiting for people to call in. Then and Blue Shield is a great company. We do a lot of work with them, but that Blue Shield agent only has one carrier to
Right.
offer. It may not necessarily be the most competitive. The other thing is that if you do enroll with Blue Shield through that agent, you're unlikely to ever be able to reach out to that agent again for ongoing service as your situation and needs may change.
Right.
Also, those captive agents, most of the time, they're not going to have access to the universe of prescription drug plans, for example. And I've seen people where they're on $180 a month prescription plan because that's what was available through them through the captive agent. They
Right.
got it. It got more and more expensive, and so they were paying way more than they need to. So that would be one type of agent, and that's difficult logistically if you have to call, a half a dozen different insurance companies and try to talk to an agent there. So they can be good agents, but there are some drawbacks. Another type of agent, which I would think would be the least recommended agent, is a call center agent. So maybe you see a commercial on television and you think that sounds great, or you get a mailer and you read it and it sounds awesome. So you call that 800 number, and it's basically a call center. A lot of them are out of Florida, in different, out of state places. And a lot of times those agents are just out to push Medicare Advantage. And Medicare Advantage can be appropriate for some people. In my opinion, I would recommend the Medicare supplement, the Medigap type of plan, but as long as it's affordable. Some people find it difficult to afford the Medicare supplement. Then we try to find them the best possible Medicare Advantage plan. But those call center agents are incentivized to enroll you quickly into a plan, and typically they may not even mention Medigap or Medicare supplement plans. And that can be a serious mistake when you're new to Medicare if you don't understand the difference between original Medicare with a Medigap or Medicare supplement versus a Medicare Advantage HMO or PPO plan. So I would say that be careful about that, because those agents may not always do a thorough job for you.
Right.
The other type of agent is kind of our model of agent, which is independent broker, a local independent broker. So, for example, I'm appointed with about 30 different insurance companies, and I can, based on my experience and all the different carriers I have available to me, I can help find you the best rates, the best coverage, maybe, the gym benefit if that's important to you, all those type of things. You don't pay anything to use an independent agent, which sometimes people wonder, well, how is that possible? Well, if a carrier has an agent sitting in their office, they have to pay that agent a salary, benefits. They have to set up their computer and IT and all that type of stuff. So it costs them a lot of money to have an in-house agent. The carriers don't pay me anything. I cover all my own overhead, my office rent, phones, everything. And so they don't pay me anything until they have a new customer. And so they're willing to give the agent a commission when they help enroll a new customer and to service that customer. Because it's not just that we enroll the person, Jack, it's that we want to keep them for a long time. I'm an independent business person. The only way my business thrives is if I do the right thing for people, I take care of them for a long time with good service, and most of the time, we get a lot of referrals from people. So we
Hmm.
really appreciate business coming into the referral. Again, the client is well served. They've got a very experienced agent with access to numerous carriers that's been around and done a lot of enrollments. They'll have us for ongoing service. and can reach out to us when they have a problem or question, and they don't pay any fee for that. So, we are a bit biased in that regard, but I do sincerely think it's the way to go for most people when they're new to Medicare.
Definitely. And I mean, it's basically just an unbiased option. It's having a somebody there that can offer you essentially any plan pretty much. And so it's really in a lot of ways obviously the best option. And um with like what you were mentioning with the captive agents and the person paying $180 for the prescription drug plan. I've seen you save people hundreds of dollars just because they're staying on the same carrier for a long period of
Yeah.
time. Um, and it kind of goes back to what you were saying about getting referrals and everything, because people are just elated when they find out that they can be saving so much money. And that's a really good feeling. I mean, obviously, you don't want anyone to overpay, but it's a great feeling when someone calls in and you say, hey, actually, I know it's been so hard for you to afford this. We're going to be able to make it, $150 cheaper a month, $200 cheaper a month. I mean, that's a big deal for people, especially in today's world where everything is so expensive.
Yeah, absolutely. I think a lot of people, they're super relieved when they get enrolled in a plan. They feel confident about it when they're new to Medicare. They've got their plan, they've got their ID cards, and they're good to go. And they kind of want to be done thinking about Medicare for for a little while. And so, yeah, having somebody there to remind you, hey, it's annual enrollment period for your prescription drug plans. That's really important. Time of the year, or your birthday is coming up. Do you want to shop your Medicare supplement in California, that type of thing. So yeah, the ongoing support is a nice and important benefit for people. You're right.
Thank you, Tim. You have a great rest of your day, okay?
You as well. Thank you.
All right.